In all my years of healthcare, I think one of the things that's always struck me the most was the emotions involved with making healthcare decisions. Topics like getting sick and dying are not anything that anybody ever wants to talk about. So they put it off. And that's understandable. It's not a fun conversation to sit down with your family when you see them a couple times a year and say, hey, let's talk about what's going to happen when I get sick. Talk about being the wet blanket at the family reunion, right? But the reality is that the best thing you could do for your family is have that discussion. Make sure that they do understand what your wishes are, and of course, make sure that you have the documentation in place that lets everybody know what that decision looks like. One of the reasons I am a healthcare advocate is when the crisis hits, I don't have the emotion that the family does. I can see things with a clear head, and I can understand the language that's being spoken, and I can help the family and the patient to understand the decisions that they face. That's why I think everybody really does need an advocate. It could be an advocate like me, a professional who comes from a healthcare background and knows the language. But even if it's a family member, everybody needs to have an advocate at the time of decision making because, again, those emotions can really cloud our judgment. It really requires someone to kind of parse through all the information, ideally record that information too, so that we have the right information coming home upon discharge. But everybody really does need to have that advocate. My name is Brett Frankenberg. My company is Apex Health Advocates. We're here for you. If we can give you peace of mind, if we can save you time and stress in those healthcare decisions, you let me know how.